This will be regarding the surveillance, screening, and contact tracing. So, as I am informing that community surveillance, if we start with surveillance done by visiting the local residents wherever the patients are and or the suspects are. So that is what we do is the community surveillance. That is in government system it is done by the Anganwadi worker, the Ashas and the ANMs and the healthcare workers which are tagged to that areas. Along with that, even in our medical college and the institutes also, the people who are working in the healthcare system, they can do what we say as a buddy screening. That is, the persons who are working in the institute, they can inform the others who are having these symptoms, and then they can be tagged for that suspected cases. So that can be done on telephone also, physically also, and we have to introduce ourselves as a faculty also there or a staff, and then we have to tell what is the purpose of surveillance and what is the information which will be gathered through that. That is done by the healthcare workers of the patient who are suspected. Contacts of confirmed cases, of course, they should be also be traced, and then they should be kept in quarantine also. And that initially, once we started with, was for quite a number of years, months, days, that is 28 days. Now, the information about the contacts can be obtained from the patient, his or family members, or the workplace, or the school, or wherever the person is working, in a hospital with the hospital personnel, or others with the knowledge about the patient's recent activities and travels. This acute respiratory infection surveillance in the containment zone should be done. That is what's started with. If you remember, once the cases were starting, then we were going for the containment zones. And if you see this figure which is being depicted in the your screens, you can see that there is a containment zone which is in the center where the helm of the affairs or the cases are there, and along with that there is another area which is in the blue line, which is the buffer zone. So what are the parameters or what are the things which are done in that? Isolation, quarantine of contacts, local mass gathering is to be avoided, and then the IEC, the active ARI surveillance, and so on. There are many things which are to be done in that area, along with the closure of schools, environmental disinfection, refraining from leaving home, establishment of control room at the block or the district level as per the increase in the containment zones, and monitoring of the rumor register, which is very important. The peripheral area where the cases are lesser, that is the buffer zone, which includes most of these things which are already there. And once the outbreak is so much that it is beyond this areas, so that becomes an endemic, and then we have an isolation and management of cases as per the guidelines. Along with that, the routine lab surveillance is there, which will be taken up by Dr. Nautiyal ma'am from the microbiology department. So I will not be going into the details, but definitely there is a lab surveillance which is there once the cases are becoming endemic. And along with that, once the endemic cases are there, categorization and treatment, lab tests, research, vaccination as per the availability, and rumor register also is to be maintained. Now, once we are talking about this, we should be knowing what is screening. Screening for COVID is that we have to look for the cases of screening of the cases of COVID-19, and I have already told that there are some cases which are suspects, which are defined as acute respiratory illness cases with a history of travel or not, with the cough, shortness of breath, and various other symptoms which will be detailed again by the medicine department, or a patient or a healthcare worker with any acute respiratory illness and has been in contact with the confirmed COVID-19 cases, which is more important for our scenario where we are working in the hospital, or a patient with severe acute respiratory infection symptoms and requiring a hospitalization, or a case from testing for COVID-19 is inconclusive. So all these are the suspect cases. And how do you confirm it? That we call as a laboratory confirmed cases who get tested positive for the lab test in the lab test. Now we had been talking about the contacts. Who are the contacts? A person who is providing direct care without proper personal protective equipment for COVID-19, and as per the requirement of the our ICU or of our OPDs, you have your norms which are laid out for what are the requirements for the COVID-19 working places. That you all have a detail, or if you need, we can plan another session for that also. Staying in the same close environment of a COVID-19 patient, including workplace, classroom, household gatherings also, and then traveling to get her in close proximity, that is around 1 meter, with an asymptomatic person who later tested positive for COVID is also to be seen. Now, who are the high risk? Of course, those where the body fluids are being touched. Of course, our staff members, they should be very careful. The ones we are touching the COVID patients, secretions, blood, vomit, saliva, we are in a high risk. Urine, feces. Those among us who have direct physical contact with the body of the patient, including physical examination and without the PPE, touched or cleaned with the linens, clothes or dishes, lives in the same household if we are having a patient in our houses, anyone in close proximity, that is within the 3 feet of the confirmed case with the precautions, without precautions, and passenger in close proximity who had flown or who had been with you and he is traveling for more than 6 hours with a COVID positive patient. And we as a worker working in the institute, we are at a lower risk once we are having our appropriate behaviors for being followed, which includes so low risk patients would be the individuals or the contacts would be who had a same class for school or worked in same room, similar and not having a high risk exposure to confirmed or suspect a case of COVID, or travel in the same environment but not having a high risk exposure. So that's all from my end. That was for screening for contacts as well as for the community surveillance. I hand it over to Dr. Anjali ma'am. Thank you, ma'am.